So, we are so happy to be doing this interview because NYU was one of our first institutional members for AOSA, which it's super important to us as an organization to have the institutional members and that that form of allyship on the broader level and that form of statement. But what made you want to become an institutional member? I think this question is really for Dr. Joseph, who signed up, but you're welcome.
Yeah. Sure. It was a no-brainer. I mean, first of all, Nicole is at our institution. Nicole,
yeah, you couldn't hide. Yeah.
Yeah, we couldn't. And so when she approached us, I mean, she's a founder of AOSA, and but I mean, there was no question we were going to support this. It just goes with our mission of supporting LGBTQ or LGBTQ residents and faculty, our mission for diversity. So there was no question that we wanted to be a founding member and we wanted to support Nicole in her vision for the organization. So, there was no question that we were going to do this. When I approached Dr. Montgomery, Bob, our chair, about this, he said, absolutely. And so we want to see the organization grow in its mission of supporting this. And we hope that more surgical departments sign on to this. It's important. I mean, the political climate is changing and not for the better. And so I think it's even more, the work that AOSA is doing is so important. I mean, as I said before, we just can't sit on the sidelines, and education is important. We have to be more vocal and more welcoming to LGBTQ and for just to talk about DEI. And we have to think of other strategies and also the impact that this is going to have on patient care. So there was no question that we were going to be founding members.
So let me ask you about that, because you've mentioned that you have tried to, and it sounds like you've had a lot of success being inclusive, making people feel comfortable. How do you do that? What has your department done that you think has worked? Because our hope is that our institutional members are not only supporters of the organization, but can be, be role models for other departments that are trying to figure out what to do, and also, can be in conversation with each other about strategies. So what have you done intentionally that you think has worked?
Yeah, so we're doing things at the department level and also institutionally. You can't do it all on your own. And Les can tell you she's been very involved in, and we've drafted her. We've revamped our residency curriculum, and we've integrated DEIA into our residency curriculum, and this is part and parcel of our curriculum all through the year. And we've also integrated this also into our NYU Brooklyn campus, which is a separate residency program. So now we're doing this cross-collaboratively. So this is so important that we just think this is something we need to be collaborative about this. And so we're in August, we're bringing the two residents together and having them come to our Manhattan campus, and we're doing a day where we're talking about LGBTQ issues. In addition to that, for the faculty, because they need to be educated on this as well. We have our cultural complications and, patient care issues that come up are discussed. And so that's where these issues are come up as well. But on an institutional level, this is important to integrate this. And I have an institutional role in this. And so we're making sure that all of the, we're collecting data on sexual orientation and gender identity very carefully across all of our campuses, because we can't make changes in patient care if we're not collecting data on all of our patients, whether it's on race, ethnicity, sexual orientation, gender identity, to know how, to make really, to make interventions on patient care. And also educating our staff, misgendering, how do we prevent that? These are all things that we are tackling across the institution, educating our nurses, educating our dining staff, things like that. So it's not just in the department, we're doing that, but it's across the institution. And this has to come from the leadership, the executive leadership. And so the message has come from the top down. And that's how you start to create change. It can't just be one person.
Yeah, I think that makes a lot of sense. It's really interesting. Maybe Les, if I can ask you to add some specifics to what Dr. Joseph said in terms of the resident education. What does that? Yeah, what does that mean? What does that look like?
So I think like residents are kind of like wet clay, right? You have like, I mean, I say that as like a very proud piece of wet clay that like you can be molded by the culture around you, right? And so like when I think about talking about NYU or why I chose to come to NYU, I think about like we take care of the patient no matter what. And we take care of the patient in a way that's respectful and inclusive of their culture and identity. We provide the best care possible, no matter of like race, creed, ethnicity, SOGI, income, insurance status. And I think that like I really feel that kind of from the top down as something that must be like the cornerstone of how I operate, both figuratively and literally. In terms of specifics, I think it's really important, like Dr. Joseph mentioned, we have now a dedicated time at our morbidity and mortality conference to discuss cultural complications that come up. So I think one of the things that people who maybe are a few decades, into their careers have a real fear of like cancel culture and like, oh my God, if I don't get it 100% right all the time, then I'm just like the worst person ever and I shouldn't even talk to medical students. And I think it's really important to have a forum like Cultural Complications where you can hear people say like, hey, I misgendered this patient. They felt really not okay prior to their surgery and pre-op holding. And that's a mistake I made. And I think hearing surgeons discuss mistakes that they make, not only with respect to like operative planning and decision-making post-op, but also in terms of like respecting and caring for patients holistically is really critical. Like it's probably one of the most important things I've taken away from my education here is that like you have to admit your mistakes and like learn from them. So I think watching our faculty do that is really impactful because you operate from a place of like, I can't be defensive. I have to be like moldable and willing to like grow from each patient interaction. So I think that's one thing. I don't know if that answers a question. And then in terms of like, what we do on the resident level, I think that there's a real emphasis on like, this also comes from the top down, like we're like a surgery family. And that means like Dr. Joseph doesn't just know about me. She knows who my partner is. She knows my partner's a home organizer. Like she knows about me. She knows me. And I feel like that's good, right? Because like it means I can look to her for mentorship and guidance and advice, and she knows where I'm coming from. And I think that our faculty really like I've noticed like multiple of the new interns, the faculty will say like, oh, are you, do you have a partner? And they're very careful about saying like the word partner, what do you do for fun? Or like they make it kind of inviting. And I think that's really important in terms of a cultural tone.
Yeah.
I also just wanted to add, Eleanor, that when we have these cultural complications, when we have these difficult conversations sometimes, we do it in a safe space so that people, we know that people are coming from different, they're at different places in their journeys of understanding, and people want to learn. We know that some people are not quite there yet. So, we know that, some people may feel uncomfortable or afraid to ask questions, but we want it to be in a environment where people can ask questions if they don't know. Sometimes people just they really don't know what to ask.
Yeah, that I feel is so, like, I've had surgeons who specifically ask me, like, so what is it with like the pronoun thing?
Yeah.
Like, how do I do it?
Yeah.
Which is like kind of crazy if you think about it, because I asked them the same question, like, so how do I do the incision? Like, can you just show me? And so I think that if you make the space for that, it kind of creates an environment where like we're all kind of learning together. And I think that's good.
Yeah. And I think with both of those examples, probably a lot of the time, you can say once you have a little bit of experience with it, it's really not very hard. And so they're both very learnable skills. So some incisions are hard, I guess.
Yeah.